These 3 closing techniques help me smash multiple sales targets and be recognized as an elite performer at 3 of the biggest pharmaceutical companies in the world. And today, I'll break them all down for you so you can simply copy them and enjoy the same insane sales results fast. To my loyal subscribers, welcome back to the channel and thank you for your support. If you're new here, welcome to Finding Pharma, the channel that is more addictive than crack cocaine. Completely legal, of course. Now, many sales professionals, from beginners to veterans, often ask the question, how do I improve my sales skills? And undoubtedly, the one area where we often struggle is asking for the business. So let me share my 9 years of industry experience with you and stick around to the end as I reveal 3 very common mistakes that I often see made, in particular in primary care sales, that you must avoid at all costs. And as a bonus, I'll take you on an impressive lunch run. Now, I have to run for a customer appointment, so we are going to have to walk and talk. Now, the whole objective of the close is to make it really, really, really hard for the customer to say no. Up until this point, we have followed the structure of intro, body, close, and I've already done an episode on that, which I'll leave a link in the description too. But as a recap, in the intro, it's all about effective questioning. We want to have uncovered 3 things, summarized by the acronym PTP. The first P being patient numbers, T, treatment goals or challenges, ideally both, and the final P is prescribing behavior. What are they doing now? But not just what are they doing, why are they doing that? Then we go into the body and we talk about how our drug, our offering, our product is going to help them achieve their goals and address their challenges. So when we finally get to the close, it's all about connecting the dots, and selling is about change. If you can help your customer visualize what they want to achieve and how to get there, their desire to act is going to be much greater. Now, you're going to have to forgive me as I put the camera away and focus on the road, but also get myself in the right headspace for this customer call. I'll chat to you real soon. Hey guys, so welcome to my lunch break. I was just at the hospital cafe with one of my doctors and we finished up. I thought, given the little bit of sunshine that we're getting in Sydney, I'd come to sit outside and enjoy my lunch with you guys. I've got a delicious Mortadella Focaccia for lunch today. It was a cold sandwich, so I asked them to toast it for me. I do prefer having hot food. And yeah, as you can see, I didn't really get to eat much of it because I was busy chatting and taking notes with the doctor. And that's just part and parcel of our roles as sales reps. We're going to be seeing doctors during their lunch break, and that's going to mean you need to plan accordingly. If you're someone like me that gets hangry quite easily, definitely have a brunch snack at around 11 a.m. And so you can carry through to now it's about 2 p.m. and I'm having my lunch. To the point of lunch though, and I'm absolutely starving, have a look at this Mortadella pistachio focaccia that I've got here. As I've said, I've been thoroughly impressed with the hospital food offerings. My favorite places to go are definitely St. Vinny's because they've got Darlinghurst around the corner. But generally, most of the hospitals, the on-ground cafe is amazing, and Royal North Shore is no different. I know there's a massive focaccia craze going on at the moment, so let's dig in. So now that we're finished eating, let's talk about another type of closing, and that's the 3 closing techniques you can use, summarized by the acronym CCC. Now, the first technique is called the checklist close, and that is all around ticking off what the doctor has revealed to you is important to them in the introduction and body of your call. So that might be some of their treatment goals around efficacy and safety of the drug. And here you might close with something along the lines of, so doctor, we've talked about how drug ABC is going to give you better reduction in blood pressure, so your treatment goal, and also less chance of hypertension or dizziness, which you mentioned is a challenge for some of your patients. Based on this, would you be open to prescribing drug ABC for your next patient? And I don't think the checklist approach is really nice in that it's soft, it's adding value, and it gains a little bit of that initial commitment, which is what we want from closing sales deals. The watch out here though is to just randomly list everything that you talked about in the body, such as, look how drug ABC reduces blood pressure by 10 units. And if you've already said that in the body, no need to repeat it. What you're really looking to do is show the doctor where they are now, where they want to get to, and how they can get there. And if you can paint that picture out nice and clear for them, you should be able to effectively use the checklist close. The second closing technique is the challenge close. And that is where earlier on, you've uncovered a challenge that the doctor's experienced. For example, it might be, David, I really struggle with my patients because they don't take the medicine. The adherence is very challenging. So how you can use the challenge close is, okay, doctor, if I show you that this drug, ABC, is going to result in much higher compliance because it's only dosed once a day or once a week or once a month, would you be open to trialing it? And again, you're solving the doctor's main challenge and adding value in that way. So that's another way to close. The final C for closing is the confirmation close. And this is a very interesting technique, particularly in primary care sales. As we often hear, someone needs to see something 7 times before they make a change or before the message resonates. And so the confirmation close is actually getting the doctor or customer to play back to you everything you've told them, to confirm that they understand the benefits and that it's sort of ingrained in their mind. So it might look something like, so doctor, we've talked a lot about the benefits of drug ABC today. If there's one thing that really stands out to you in the data we've looked over, what would that be? And then they confirm back to you, it was the amazing efficacy result or the outstanding safety. I've also seen some other company reps actually ask them to play back specific data points. Now, I haven't been game enough to do this, and let's talk about some of the mistakes that I would caution. So the 2 most common mistakes that I would avoid are, number 1, time pressure or trying to rush the doctor into a decision. Doctors are very intelligent people. They often have the highest academic marks, so they're not silly. And let's be honest, no one likes being bullied or pressured into making a rush decision, especially when it comes to medical decisions. I think most doctors are quite rational rather than emotional, and so they actually appreciate when you back off and give them a bit of space to digest everything. And you also have to factor in, they've probably had a massive day, so they might need time to marinate. I know for me, I'm quite a marinator. I like to think things through before making a decision. And I believe that's actually been part of my pharmacy training, to critically analyze things, to be a little bit skeptical before coming to a decision on the spot. The second mistake that I've seen in pharmaceutical sales is begging, where pharmaceutical reps come in and they almost beg the doctor, please, please, just write 2 scripts. That's what I'm asking of you today, with no sound, logical evidence. And again, doctors are playing with people's health, people's lives. They are not going to write you a script because you've begged them. You need to present a very compelling, logical argument for why they should be using the drug. So please avoid those 2 mistakes. Otherwise, I think it's going to really negatively impact your reputation, your credibility with the doctor, and it's only going to make it harder and harder for you to convince them why they should be using your drug. Nobody feels confident to make a decision when they smell desperation. Just like at a nightclub when there's the desperate guy trying to pick up every girl. And similarly here, you need to be confident. Close with a punctuation mark and have that abundance mindset that if the doctor sitting in front of you right now doesn't want to trial your medication, that's okay. There's plenty of other doctors out there who would be willing to give it a go. And you can come back to this doctor another time. Maybe they just need a little bit longer. Now, if you've learned something from this content and think it's going to help you close more deals, subscribe to the channel for weekly wisdom that is more satisfying than popping bubble wrap. Now there are two other impactful closing techniques I haven't covered in this episode, and if you're keen to hear about them, please let me know in the comments below and I'll make an episode.